Sir, we are live now. With all your permission, I'm
Yeah,
starting this
yeah, sure,
session.
sure, sure.
A very good evening to all. I welcome all the participants on today's session. Let's welcome today's speaker with great honor, none other than Dr. Shri Sarath Kumar sir. Sir has done MS, PhD, and super specialist in sexology and infertility. Dr. Sharath Men's Clinic, director at Mediwave Fertility Research Hospital. Today, sir is going to discuss on a topic management of premature ejaculation. Let me tell you overview of the topic. This webinar will aim to provide a comprehensive understanding of premature ejaculation, that is PE, and offer practical strategies for its effective management. So by taking not much time, I would like to invite sir and hand over this session to sir. Sir, over to you. Stage is yours.
Good evening, all the doctors who have joined me. And I'm extremely happy to be here with IJCP people. Good evening for us. Thank you very much for hosting today's session. I really enjoy the CMAs arranged by IJCP people because lot of doctors join this online webinars. And even after the session, I receive so many emails and even WhatsApp calls and messages, getting some clarification on the subject. That shows the popularity of the lectures arranged by the IJCP people. And also they take and choose such a nice topics which are very interesting and very useful for the general practitioners and even for consultants. And of course, even for some general public who want to know the knowledge about these subjects. So today I'm going to talk on the premature ejaculation. Of course, ejaculation is one of the commonest sexual problems faced by the men. Next to erectile dysfunction, probably premature ejaculation is the second most common sexual disorder faced by the men. And this evening, I'm going to talk about the various aspects of premature ejaculation, the diagnosis, and also the management, medical management, as well as surgical management. So this, I'm going to talk on these chapters. I'm going to introduce the subject, define the PE. Let me tell you about the incidences, causes for PE, risk factors which may cause the premature ejaculations. What are the investigations we have to do for final diagnosis of the premature ejaculation, treatment aspect, and side effects of the treatments. And of course, I'm going to give you a carry home message also. So premature ejaculation is, so many definitions are there. In fact, the people themselves, the men themselves, they come with a diagnosis. I have got PE, sir. And even the doctors, they send to me, sir, this person has got PE. Many times that person may not have PE, but it would have been diagnosed as PE. So to define the PE, one should understand the exact terminology for the real clinical diagnosis of PE. Although definitions of PE vary, the International Society of Sexual Medicine, ISSM, defines PE as a male sexual dysfunction in which ejaculation always or almost always occurs prior to or within 1 minute of penetration. So this is very important. The time starts after the penetration, not before the penetration. So anything, the foreplay and other handling the penis and even other sexual activities, that is not taken into account for the premature ejaculations. Only after the penetration, the time starts, and if it occurs within, say, 40 to 50 strokes or 1 minute, then it is called as premature ejaculation. Earlier, the definition was when a man has an orgasm before intercourse or less than 3 or 4 vaginal insertions, stroking, and these were also taken into account. And another thing is, once in a way, premature ejaculation can occur to any man, and that doesn't fit with the definition of PE. If it occurs frequently, more number of times, often, then only we call it as premature ejaculation. And it should be persistent. It should be from past 6 months. Just if there is a premature ejaculation with a history of 1 week, We just ask them to wait. Of course, he may come back to normalcy after a week. So if it is persisting and is occurring frequently, and it is occurring from past 6 months, then the diagnosis of PE is done. There are so many other definitions. There is no set time when a man should ejaculate during sex. But if the person ejaculate and lose erection soon, the another definition is when the partner is not satisfied, or if the man is not achieved the orgasm, then also the diagnosis of PE is made. There are several criteria for the diagnosis of PE. Before any diagnosis of PE is made, the following criteria must be ruled out. The partner factor, the partner sexual problems and health issues. If a partner is in a great hurry, if she has got a lot of pain, and if she doesn't want the intercourse to last longer, then the man will be forced to ejaculate quickly, and then the diagnosis of PE may not be suitable. Relationship factor, communication problems, different levels of desire for sexual activity or partner violence also come to the picture. In other words, partners' cooperation is very, very important. If there is no cooperation from the partner due to any reason, the man may ejaculate due to frustration, and then that doesn't fit into the diagnosis of PE. Individual vulnerability factors, history of sexual emotional abuse, existing psychiatric conditions such as depression, stressors, they have to be kept in mind. Cultural or religious factors, inhibitions or conflicted attitudes regarding sexuality, they should also be kept in mind. Many medical factors, existing medical conditions or the effect of drugs should be kept in mind. So, friends, that's what the premature ejaculation definition is, and exactly when we should label a person as having a PE. So these above criteria should be kept in mind. Now coming to the classification of the premature ejaculation, we classify the premature ejaculation into 4 types. The first and foremost is a lifelong premature ejaculation. This person never had a good intercourse. So right from the beginning of his sexual career, he is ejaculating within 1 minute or within 2-3 minutes. Then it is called as lifelong. Acquired premature ejaculation is totally different. Earlier, you used to do 5 minutes, 10 minutes intercourse. From past a few months, is this capacity to do the stroking has come down to 1 minute. That is called as acquired. That is the origin, the onset is recent. The third one is situational or subjective. A particular person may have perfect intercourse with partner A, but when he goes to partner B, he ejaculates quickly. And that is called as subjective or situational. Same partner in his bedroom, he may take 5 to 10 minutes for the ejaculation. With the same partner, if the place is changed, he may ejaculate quickly due to various reasons, due to environmental factors. That is subjective or situational. That is the third type. The fourth is variable. Sometimes he has perfect intercourse, sometimes he doesn't have. So with the ex-partner, he'd have same partner. Next time he doesn't have the intercourse to the fullest extent. That is variable. That is the fourth type. So, friends, these are the types of premature ejaculation. The classification is important because the treatment depends upon the type of ejaculation. Coming to incidence, it can be frustrating and even embarrassing, but it is a common issue for men. Between 30 to 40% of men have PE at some point in their life. That shows the enormous number of men suffering from PE. Most of them, they may not even come to the medical aid. They may be suffering just silently. PE is only a problem if it happens frequently. Most men occasionally reach orgasm sooner than they would like. It is common for a man to ejaculate quickly the first time he has sex. That is due to situational. Then we don't call it as PE. Ask him to wait. Come on. You have plenty of time. You have many more innings to play. Just like even the best of the best batsman may get a duck out on the first innings. Second innings, he may hit a century. Just like our G.R. Vishwanath. When he started his career as a cricketer, the first innings at Kanpur, he was duck out. In the second innings, he went on to hit 134 runs. So like that, first time anybody, he may ejaculate quickly because of so many factors. So keep in mind, it is not something wrong. Worry about it if it happens occasionally. Let us come for the causes of PE. What are the causes a man may encounter to land up in the diagnosis of PE? Hormones. Men who have got low serotonin in their brain tend to take a shorter time to ejaculate. So serotonin is the one hormone. If it is low in the brain, the person will ejaculate quickly. Emotional factors can play a role. Negative feeling about the sex can play a role. Erectile dysfunction many times go hand in hand with PE. Most of the times, many men who come to me, they will have three things. Sir, I have got erectile dysfunction, premature ejaculation, small penis. I call it as speed. SP, small penis, ED, erectile dysfunction, PE, premature ejaculation. So speed is the one of the commonest condition. So many times, premature ejaculation is not the only one. The man may be suffering from multiple sexual disorders, that is small penis, erectile dysfunction, and premature ejaculation. Men who are anxious about obtaining or maintaining erection during sexual intercourse might form a pattern of rushing to ejaculate because he wants to quickly finish it off before the partner comes to know about the problem. He wants to get out of this situation. That's how a person who has got ED lands up with PE also. So coming to the various causes for the premature ejaculation. Psychological causes. Early negative sexual experiences, emotional factors can play a role. Guilt feeling that increase the tendency to rush to sexual intercourse encounters. Negative feeling about the idea of sex, sexual depression, worrying about premature ejaculation, sexual abuse, poor body image, stress, depression, anxiety, relationship factors. These are all the psychological factors which cause the premature ejaculation. There are several biological causes also. The number of biological factors might contribute to premature ejaculation. They include abnormal hormonal levels, abnormal levels of neurotransmitters in the brain, inflammation and secondary infection of the prostate or urethra, inherited traits may be some of the causes, biological causes of premature ejaculation. Coming to physical causes, there are certain conditions like phimosis, tight frenulum, bent penis, small or micro penis, hypersensitive glands penis. These are all some of the causes. Phimosis, as I've seen, I'm practicing sexology from past 25 years, 98 I started. Right from that date, I have seen hundreds and hundreds of patients with phimosis, premature ejaculation go hand in hand because in phimosis, what happens is the foreskin is so tight. When it tries to penetrate, the skin tries to come back and there will be slight cracks. He gets pain. And to get rid of the situation, he ejaculates and run away from the situation. So phimosis is one of the commonest conditions wherein the premature ejaculation occurs. Second one is tight frenulum. It is similar to the phimosis. In tight frenulum, what happens is once there is erection, during intercourse, he tries to push the glands and the frenulum holds the glands in such a way, it pulls back and there will be little pain. Just like while riding the horse, we pull the trigger so that the heart stops. Like that, this frenulum works as a trigger and the person ejaculates quickly. Bent penis also, because of the inability to penetrate properly, there may be pain also in perineus disease and premature ejaculation occurs. And with small and micro penis, there will be some sort of inhibition, some sort of inferiority complex for the male partner. He doesn't want to expose himself too much to the situation. He just ejaculates and get out of the bed before the partner comes to know what's happening. The last one, which I have seen very frequently, is hypersensitivity glands penis. Many men, especially unsubscribed men, they never pull their foreskin back and clean it, and the glands penis will be so sensitive. It will be tender. It will be reddish. It will be very, 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 what you call it, as sensitive. That is, even with little touch, it explodes. It sends the signals to the brain, and the brain triggers. The neurotransmitters are released, and the person just ejaculates. Because the gland penis is so sensitive because it is not exposed to the atmosphere. It is always covered by the prepuce, and rarely the person opens the prepuce, and he never cleans it, and he lands up in the hypersensitive glands penis. Coming to risk factors. What are the risk factors a person may land up in the premature ejaculation? Prematurely can be a problem for men with erectile dysfunction. So ED is one of the risk factors. That is when the penis doesn't remain firm enough for sex. So in ED, what happens is a man is ready to have a good intercourse. He has got good direction. He starts pumping, the erection stops, comes down. So to get out of the situation, he ejaculates and comes out because he wants to complete the sexual cycle so that the partner will not be dissatisfied. So ED and PE go hand in hand. PE is closely related to female sexual function, and the condition affects each other. There may be some hereditary factors, genetic factors. Obesity is another frequently seen disorder where premature ejaculation is there. What happens is in obese persons, he is unable to perform for longer time because he has to carry his own weight. The abdominal weight is so much. He, with few pumping action, he gets tired and he wants to get out of the situation by ejaculating and come out. Smoking is another risk factor. Men who are worried they would lose their erection may develop pattern of rushing to ejaculate. It can be a hard habit to break. So friends, these are some of the risk factors. Of course, diagnosis is written on the face of the person who has come to you. He himself comes and says, Doc, I have got a PE. No need of any other explanation other than asking one simple question. How frequently you have PE? Do you have the PE with all the partners? Do you have the PE with in all the situations? Are you having the PE right from the beginning of your sexual innings, or has it started recently? So history taking is very, very important. And this history taking will tell you what is the type of premature ejaculation he has got, whether it is lifelong, acquired, situational, or variable. So in the history itself, the diagnosis is written. Detailed history has to be taken to know the type of PE because your treatment depends upon the final diagnosis. Physical examination, as I told you earlier, to rule out the biological and the causes of infertility, the premature ejaculation, that is bent penis, perineus disease, tight frenulum, phimosis, all these, and micropenis, small penis can be done only by physical examination. And never forget to pull the foreskin back and see whether the person is maintaining his genitals clean or not. because many times I am surprised to see and tell you that I have done lot of diagnosis of balloonoposthitis by just pulling the skin back, foreskin back, and that itself was the cause for the premature ejaculation because infections cause premature ejaculation. Routine investigations to rule out diabetes, hypertension, hypercholesteremia, body mass index, all those have to be done to rule out concomitant causes for P. Special investigations, hormone studies, color Doppler penis can be done if necessary. Otherwise, most of the times the diagnosis is well written on the wall of the room or on the forehead of the person who is sitting in front of you. So, friends, diagnosis is very easy. And what happens if the premature ejaculation is not treated? So many complications can occur if the PE is not treated. Relationship is affected by the PE. Talking about the problem is an important first step. Counseling with the partner is very important. To some extent, the quality of life for patients and their partners, including the sexual satisfaction of both partners, sexual confidence, and interpersonal relationships are influenced by PE. So a happy family depends upon not just all the what vehicles they have got, how many kilograms of gold they have got, how many kgs of silver they have got, what is their income, whether it is in lakhs or crores. Unless they're happy in the bedroom also, their relationship will not be that good. So interpersonal relationship is affected in P. P may also take it hard to start a family because the sperm may not reach an egg to fertilize it, or depression related to P might affect sex drive or performance. Couple may land up in infertility also. Because what happens is, in severe premature ejaculation, the ejaculation occurs before the insertion of the penis into the vagina. Then the person lands up in PE and infertility. With PE, person might feel to lose some of the closeness shared with a sexual partner. One might feel angry, ashamed, and upset and turn away from the partner also. Many times, family may break because of the premature ejaculation. So, friends, that was all about the premature ejaculation, the definition, causes, and the what are the risk factors, what are the types of premature ejaculation, how to diagnose it, what are the investigations to be done, and what happens if the premature ejaculation is not treated, that is the complications or the outcome of the PE. Now let us jump on to the best part of the premature ejaculation talk, for which you are all anxiously waiting. I know you want to know the treatment. Treatment depends upon the type of PE, which I had already told. So, to start with, lifestyle modifications, behavioral therapy, use of condoms, local applications, oral medicines, other treatments, combined treatments, and surgery. These are all the available gadgets in the treatment of management of premature ejaculation. Let us go one by one. Lifestyle modification is very, very important. Lifestyle modification strategies are foremost in the treatment and prevention of the PE also. There is complete agreement that weight loss is associated with significant improvement in the clinical abnormalities of PE for the persons who have got obese. If the obesity is severe or morbid obesity, then lifestyle modification is very, very important. Even men with borderline obesity, say body mass index between 25 to 30, they also get a sort of relief if they lose weight by few kgs also. Body mass index between 30 and 35, that is obesity grade 1, they require real change in the lifestyle. And severe obesity, body mass index between 35 to 40, they must undergo severe lifestyle modification, diet, exercises, even medications to bring down the weight. And morbid obesity, the obesity of the order of body mass index more than 40. They require surgical interventions, liposuctions, and even surgeries to cut down the gut, to cut down the absorption of the food, and medications also to bring down the body weight. Similar to role of lifestyle modification, the management of P, there may be a role for lifestyle modification to prevent regression, progression, or even enhance the regression in the earliest manifestations of PE. And of course, these lifestyle modifications will increase the erectile function also. And most of the times, since PE and ED, they go hand in hand, lifestyle modification will give real good results for PE. Second and foremost treatment is counseling. This approach involves talking with a sexologist or a psychologist or a psychiatrist about relationships and experience. Sessions can help to reduce the performance anxiety and find better ways of coping with the stress. Counseling is most likely to help when it is used in combination with drug therapy. The partner also might be upset with the change in sexual intimacy. PE can cause partners to feel less connected to her or her. Talking about the problem is an important step, and relationship counseling or sex therapy might be helpful. So, friends, counseling is not just telling the person, okay, you will start performing well like that and give medicine and sending. Counseling involves real psychological treatment or psychotherapy. Call the partners also. Tell them in detail what is premature ejaculation, how to come out, what are the modes of applications of treatment available, and why treating the premature ejaculation is important, and convince them to take a full course of treatment so that they will have a happily married life or good sexual relationship. Coming to the behavior therapy, 95% of men are helped by behavioral techniques that help to control the ejaculation. Stop and start technique. You and your partner stimulate your penis until you feel like you are going to have an orgasm. Stop the arousal for about 30 seconds or until feeling passes. Start the stimulation again and repeat 3 or 4 times before you ejaculate. That is just like stopping a vehicle for some time and starting it again. Because if the vehicle is going at a very fast rate, it may land up in accidents. So what we do when we are going in a highway, there will be speed breakers. Why they have kept the speed breakers? Because they know if you go at that high speed, you will end up in accidents. Like that, for preventing the premature ejaculation, stop the stroking activity, take out the penis and start again. That is called as stop and start technique. If you practice regularly stop and start technique, within 6 months, you will come out of the premature ejaculation because it's a behavioral therapy. That is modification of your behavior. The next is the squeeze technique. It works the same as the start and stop method, but when you feel like you are reaching the orgasm, you or your partner squeezes the head of the penis until you lose the erection. Repeat this a few times before ejaculation. So this is another very good technique. But unfortunately, this squeeze technique doesn't work for men who have got erectile dysfunction, because by squeezing, the person loses the erection, and a person who has got erectile dysfunction may not get the erection again. Or even for elderly citizens, elderly male population, they may not get the erection second time if the erection goes away by squeezing. So this squeeze technique is helpful for young men who can get the erection quickly back. Otherwise, don't try this method. Third behavioral therapy is the mind diversion. Some men find that if they think of something else during sex, they can last longer. That is diverting the attention from the sexual mode to non-sexual. They may get the ejaculation postponed. Or if they remember something very, very bad incidents, the boss scolding him, or the wife hitting him, or something, what happened, very bad thing in his life. If he remembers that, the sexual arousal will come down and the erection will come down and the ejaculation will be postponed. That is called as mind diversion technique. So other types of behavioral therapy are strengthen your muscles. Weak pelvic floor muscles sometimes contribute to PE. Yoga and exercise, pelvic floor exercise, help to strengthen these muscles. Kegel exercise may help to strengthen them. Find the right muscles to tighten by stopping your urine in the midstream. Hold them tight for 3 seconds and then release for 3 seconds. Do this 10 times, at least 3 times a day. Then your pelvic floor muscles, especially the muscles around the bulbous cavernosa and the urethra, they get strengthened and you get control over the ejaculation. Masturbation is another technique. Masturbating 1 or 2 hours before you have a sexual activity may help to delay the ejaculation, because by masturbation, you have sufficiently released the semen, and to recap that semen, it takes time and the ejaculation is postponed. Another technique is PRM, penis root masturbation. It is performed by placing the thumb or thumbs on the root of the penis and rubbing the penile root up and down or circularly with a certain degree of friction. This may help to overcome the premature ejaculation. Another technique is wear a condom. Condom might decrease the penis sensitivity, which can help to delay the ejaculation. The climax control condoms are available over the counter. These condoms contain numbing agents such as benzocaine or lidocaine and are made of thicker latex to delay the ejaculation. But unfortunately, many partners, the lady partner may not like the condom because of various reasons. And men and couple who are trying for the conception, they cannot use the condom. So there are some limitations of using the condom. And those who are allergic to latex, they may not like the condom. And another problem with some men is, while putting the condom itself, they lose the erection. And they say that their sensation is lost. They don't enjoy much with the use of condom. So there are certain limitations for using the condom. And at the right time, the condom may not be available on the spot. They might have forgotten to buy, or the sexual encounter was very quick, unexpected. So you may not be able to reach for the condom. So these are some of the limitations for use of the condoms. Coming to medications, the first and foremost medication is local anesthetic agents. Anesthetic creams and sprays that contain numbing agents such as benzocaine, lidocaine, prilocaine are sometimes used to treat PE. These products are applied to the penis 10 to 15 minutes before sex to reduce the sensation and help the delay the ejaculation. A lidocaine prilocaine cream combination cream is also available. Lidocaine sprays are also available in the over-the-counter, even without prescriptions. Coming to real medicines, the most of the medicines which you use for premature ejaculation are antidepressants. A side effect of certain antidepressants is delayed orgasm. For this reason, selective serotonin reuptake inhibitors, SSRIs, such as escitalopram, sertraline, paroxetine, fluoxetine are used to help to delay the ejaculation. Depoxetine, this is an SSRI that is often used as a first line of treatment. Paroxetine seems to be the most effective. These medications usually take 5 to 10 days to begin work, but it may take 2 to 3 weeks for treatment before you will see the full effect. If SSRIs don't work, you can try tricyclic antidepressant, clomipramine may be tried. Several analgesics like tramadol is a medication commonly used to treat pain. It has the side effect of delayed ejaculation. It might be prescribed when SSRI haven't been effective. Tramadol can't be used in combination with an SSRI. PDE5 inhibitors, that is phosphodiesterase 5 inhibitors, some medications used to treat ED, that is sildenafil, tadalafil, sildenafil, avanafil, or vardenafil, may also help to prevent the PE because many times PE goes hand in glove with the ED. These medication might be more effective when used in combination with SSRIs. So friends, some of the medicines used, I have given the chart. Those who are interested, they can go through the chart again because this is going to be saved. This lecture is going to be saved. Later on also, you can contact the IJCP people and can retrieve the images and go through the chart in detail. So I have given the drugs, usage, and dose also. Citalopram, fluoxetine, paroxetine, sertraline, and depoxetine. Depoxetine has to be taken 1 to 3 hours before, and sertraline 3 to 5 hours before, paroxetine 1 to 3 hours before, fluoxetine has to be taken on daily dose, citalopram has to be taken in daily dose. And the dosage also I have given. You can go through them whenever you want. The other drugs used are adrenergic nerve blockers. Adrenergic nerve blockade has been proposed as a treatment for PE. A clinical trial showed modest effect with alpha-zocin and terazosin tablets. Silidocin is a highly effective alpha-1A adrenoreceptor antagonist and on-demand use of 4 mg silidocin orally 1 hour before sexual intercourse in the treatment of PE was found to be effective in improving PE profile. And the IELT, intravaginal ejaculatory latency time. The treatment was based on the fact that emission and ejaculation are under the influence of the sympathetic nerve. So silidocin, alpha-zocin, terazosin are in trial. Coming to side effects of these medicines, most of these medications also have side effects that includes nausea, drowsiness, just like any other medicine. Most common side effects, depoxetine, including dizzy and faint and feel sick, nausea. Drinking a full glass of water at the same time as taking the tablet can reduce these side effects. Common side effects of depoxetine and sildenafil are dizziness, headache, nausea, stuffy nose, facial flushing, indigestion, dry mouth, vision problems such as light sensitivity or blurred vision. These side effects usually resolve without requiring any medications. Local anesthetics can cause ED, although topical anesthetic agents are effective and well tolerated. They have potential side effects. Some men report temporary loss of sensitivity, decreased sexual pleasure. Sometimes female partners also have this side effect, especially when the man uses the local anesthetic agents, because that local anesthetic agent, when it touches the vagina becomes numb. So she will not enjoy the sex. Apart from the medicines, several nutritional supplements have been tried for the PE, L-arginine, L-citrulline, propionyl, L-carnitine, flavonoids, zinc, vitamin D, L-methylfolate, folic acid, DHEA, caffeine, ginkgo biloba, ginseng, or pentac ginseng have been tried to treat PE. And several alternative medicines have been tried, including platelet-rich plasma injection, low-energy shockwave therapy, acupuncture, vacuum pump, penile ring, vibrator therapy, sun therapy. they meet with certain amount of success with some people. And as I told you, P and ED, many times they coexist. And P can be a problem for men with ED. That is, when the penis doesn't remain firm enough for sex. Treating ED may be take the premature ejaculation, go away. There are many medications, that is, in combination of SSRIs with PDE5 inhibitors, we can treat P and ED together. Friends, that was all about the medicines, including the pharmaceuticals and nutraceuticals. And coming to the surgical management of premature ejaculation, in cases where unusual treatment methods are unable to improve PE, surgery may be a very viable option. Surgery is particularly recommended to reduce hypersensitivity of the penis, a common mechanism that promotes early ejaculation. The surgical technique includes circumcision if the person has got phimosis. Even men who doesn't have the phimosis, they may also find the circumcision useful as a tool for remedy for PE. Selective dorsal neurectomy is very useful in some individuals because the dorsal nerve will be cut. Inner condom technique, cryoablation of radiofrequency of the dorsal nerve, hyaluronic acid, HA, gel glans penis augmentation, pulsed radiofrequency neuromodulation can help some individuals. Frenectomy, removing the phylum, may help some people. Varicosilectomy, rarely it is recommended, but I have just given the list because if one has got severe varicocele of the order of grade 3 or grade 4, doing the varicosilectomy may help them to get this semen count improve, and indirectly it may help the treatment of ED and PE in people who have got infertility. So friends, this is how the dorsal nerve neurectomy is done. Selective dorsal neurectomy, that is the dorsal nerve is selected and it is cut. Cut can be done by microsurgical denervation of penis. It is highly efficacious operative technique, can be used as an alternative method after the failure of the conservative treatments. Decreasing penile sensitivity gives better control over ejaculation and increase intravaginal ejaculatory latent time. Selective dorsal neurectomy is a permanent procedure and is often preferred to medications that require constant use. This is a permanent solution. Inner condom technique, hypersensitivity is a recognized cause of premature ejaculation. This PE treatment also aims to reduce the sensitivity of the penis. To achieve this, inner condom made up of acellular dermal matrix is implanted inside the penis. ADM is derived from the same material the skin is made from, making it compatible with the human use. This is added to the fact that it accommodates growth within the penis without leading to an immune response of the body. And this can be done in very, very rare cases where all the methods have failed. Injecting hyaluronic acid, that is gel glans penis augmentation. Hyaluronic acid may get most of its attention for anti-aging benefits, but this acid also holds promise for helping to relieve the PE. The benefit is thanks in a part of the little known fact that HA is a natural component of the human body and is found in the skin, eyes, and connective tissue. This in turn permits its application as a safe filter for penis, leaving little risk for producing an autoimmune reaction from the body. Frenectomy or frenectomy or frenectomy. Frenectomy has been studied as a possible surgical therapy for PE. I have done a lot of frenectomy, and it is found to be useful because of the association of PE with short phylum breve, that is called as phylum breve. This condition can be congenital, resulting in defects during sexual development or acquired secondary to excessive scarring occurring after rupture of a normal phylum. It hinders the complete retraction of the prepuce during erection, causing ventral curvature of the glands, that is bent penis, resulting in premature ejaculation. Varicosilectomy, I don't advocate unless the person has got low sperm count and if the varicose is of the grade 3 or 4. There are several risks for the surgical treatment. Despite having proven benefits for managing premature ejaculation, surgical treatments are not popularly practiced in most countries. In fact, International Society of ISSM does not recommend selective dorsal neurectomy or penile augmentation with hyaluronic acid or treating PE for treating PE. Surgical treatments are particularly disapproved of because they can increase the risk of permanent loss of sexual function. This is coupled with lack of studies and data on effectiveness and safety. General risk of surgery, anesthetic risk, and possible just like any other surgery. So friends, keep the surgery for the end, not for the beginning. If nothing works, then take the scalpel and the blade, not in the initial stage. And also take proper precautions and also 100% written consent from the patient that the surgical treatment is not the real options for treating the PE. Only if the person is willing voluntarily, then do this surgery. So friends, that was all about the premature ejaculation, the diagnosis, management, types, and occurrence, incidence, and also risk factors, and various types of management, right from psychological management, behavioral therapy, medical therapy, surgical therapy. To conclude, premature ejaculation is a commonly encountered male sexual dysfunction with potential negative impact on the patient and his partner. In the present review, we explored the different therapeutic approaches that are currently available for the treatment of PE, including behavioral, pharmacological, surgical options. Interestingly, the medications currently used in the treatment of PE are sold off the label also. They are even sold on the counter. Except for depoxetine, which provide effective on-demand treatment regimen with relatively minimal side effects, all other drugs are not that effective. If all the medical treatment fail, surgical methods may be suggested and should be kept in the end. So friends, that was all about the premature ejaculations. And the subject is open for discussion now. Any questions, I'll be very happy to answer. And over to Faraz. Faraz, are you there?
Yes, thank you so much, sir, for giving your
Yeah,
valuable time and sharing your knowledge with us and
yeah,
making
it
this
was
session
my pleasure.
informative.
Yeah, any questions for us? Any question? Hello, any questions for us?
Yes, sir. Can you hear me, sir?
Yeah, yeah, yeah.
Yeah, thank you so much, sir, for giving your valuable time
I
once
am
again,
not
sir.
seen on
And
the screen.
sir, I am able to see you, sir. You are
Okay,
clearly
fine.
visible.
Okay,
Yeah,
okay.
and for sharing your knowledge and making this session informative one, sir. It is a wonderful talk, and like this kind of situation are now common in our country, sir. I hope this talk will help all the population of our country as well as the practitioners, doctors. Sir, I can see, sir, we have received some question from the participant, and if you allow, can
Yeah,
I take this with all
yeah,
your
sure, sure, sure. You
permission?
can take all the questions. If the
Yeah,
time permits, we'll answer
yeah,
all the questions.
doctor. Yes, sir. Yeah, Dr. Dattar is asking role of tramadol and its mechanism acting on patient in PE.
Yeah, very good question. Thank you, doctor, for asking that question. I told you, tramadol is one of the options available for the treatment of premature ejaculation. As you know very well, tramadol is a uh, analgesic, and the side effect of this analgesic is one of the side effect is the delayed ejaculation, and that part of the premature ejaculation, that is delayed ejaculation, that is taken into consideration for treating the premature ejaculation using tramadol. It is a medication commonly used to treat the pain. It also has got side effects that delay the ejaculation. But tramadol has got a lot of side effects. So it cannot be used as a first line of treatment for PE. Only for severe pain we use when the regular analgesics don't work. Because as you know, tramadol has got other side effects. It can't be, and also second thing is, it cannot be used along with the combination of another SSRIs. You cannot combine depoxetin or paroxetine with tramadol. So tramadol, you have to keep it in the end. If, along with the pain, if the person has got PE, severe backache with PE, or paranesthesis, painful intercourse, dyspareunia, or painful frozen pelvis where the mobility of the pelvis is limited due to pain, then you can use tramadol. Otherwise, please reserve tramadol for the end if the depoxetin and paroxetine fail, not as a first order of vote for us.
Thank you so much, sir, for answering this question, sir. Moving forward, I can see another question from Dr. Ranjit Kumar Nayak. He is asking, what is the role of herbal products in treatment of PE?
What is the name of the doctor? You said Dr.
Yeah, sir. Dr. Ranjit Kumar Nayak.
Yeah, Dr. Ranjit. Uh, this lecture is purely allopathic, and we just believe in modern medicine, that is scientific medicine only. We usually don't advocate herbal medicines as the practitioners of modern medicine, because most of the herbal medicines which are sold in the market, they are not completely scientifically tried in double-blind controlled studies in the scientific way acknowledged by the Cochrane Review. Most of these are self-studied by some group of doctors giving some data, but a real double-blind controlled studies involving minimum hundreds of patients using minimum 5 centers and giving the patient without telling them what we are giving, that is called as double-blind control studies. That is called as research. Unless a product is accepted by intensive research, we usually don't advocate any medicine for the treatment of any disease, even let it be a common cold. So that being the case, we usually don't advocate the herbal medicines. But some of the medicines, they claim that, oh, they can work like this, like that. Yes, fine. You just try. If it works, good. But we can't generalize that one, because particularly if it works on one person, if it doesn't work on another person, then we can't advocate in general for all the people. Hence, herbal medicines, yeah, they have got limitations of usage. And another thing is, the dose is not totally micronized. Exact milligrams are not given, because the chemicals, ingredients present in these herbs are not extracted, and they are not filtered and given in milligram basis. For example, Shatavari, Ashwagandha, and so many other products, they are just given in the form of the raw material, not refined chemicals. That being the case, the dose cannot be standardized. So there are some limitations for using the herbals. Of course, if they are useful, please go ahead.
Thank you so much, sir, for sharing your experience and insight on this question, sir. We will be taking one last question for today's session from Dr.
Sure.
Snehali. She's
Yeah.
asking, what is the role of performance anxiety is acquired in PE?
Very good questions, Neha. I told you the types of in the types of premature ejaculation. So anxiety plays a major role in the premature ejaculation, because as I told you earlier, performance anxiety is one of the risk factors, because the person wants to perform in a better way and is unable to do. And that itself will cause the premature ejaculation, because he is unable to do the intercourse properly because he is aiming at something else. He wants to do more. And the anxiety may be there. Somebody may come and tap the door, or if they have gone to a lodge or to a hotel room, they will be worried if some external person come, if police come, or if the waiter comes when they are doing the intercourse, or if they are the unmarried couple, they will be worried whether the neighbors will come to know about their affair, or the house people come to know their affair. So in these situations, the performance comes to the picture, and this performance anxiety itself is one of the cause for the premature ejaculation. So in this one, even the relationship problem also comes to the picture, and the anxiety is one of the major cause for psychological cause for premature ejaculation. And to overcome that one, psychological treatment, behavioral modifications, and explaining them the situations, and to overcome all those situational and acquired causes must be taken into consideration for treatment. And most of the times, anti-anxiolytic drugs will help them to come out of this anxiety, performance anxiety, and even the medications, paroxetine, depoxetine, and local anesthetic agents, they also help them to come out of the situation and get the performance in a better way. So that's about the anxiety, Sneha. Thank you very much for asking that beautiful question. That was a very, very relevant question. And the answer is, it is one of the psychological cause, and the treatment is the counseling. That's all.
Thank you
Over to
so much,
Farah.
sir. Yeah, thank you so much, sir. Snehali has written, thank you so much. It was a wonderful
Yeah, that
presentation
was a
from
real
very,
nice question
yeah,
because that is the gist of it. Anxiety. I told you about one cricketer,
yes,
when the
sir.
cricketer goes, he will be seeing the century and the cup, not the ball, and he will be duck out
And she has
because he
also
wants to
mentioned that
perform.
she
Yeah.
used to listen to your lectures, every lectures on Med Talk, sir. Thanks for
Oh,
being
thank
there.
you. Thank you. Thank you. Thank
Yes,
you,
sir. Thank
Snehali.
you.
Thank you very much.
Thank you. Thank you so much, sir, for answering all the questions, sir. As I can see, there is no more question from the participant end. If you
Yeah.
allow, with all your permission, shall we conclude this session,
Yeah,
sir?
sure, sure. That time is also perfectly on
Exactly,
time. We
sir.
have concluded. Yeah.
Exactly, sir. Thank you so much, sir.
Thank you.
Until
Thank
then,
you.
take care
I
of yourself.
sincerely thank IJC people, MedTalk people for giving me a wonderful opportunity to address all my colleagues all over the country, even abroad also. I have received so many emails and also WhatsApp messages after the lecture that shows the popularity of EJCP lectures and MedTalk lectures. So hope we will have some many more such lectures. Thank you very much. Good night to you.